no one ever wants to talk about HIV disease because it's a sexually transmitted disease. When we were talking about the blood supply, that sort of thing, it was there. But now it is actually about a behavior. It's always been a behavior. But now we don't want to talk about sex. For the last few years, we've gone through abstinence only. No one actually wants to talk about children and teenagers being sexually active. You want to lose some friends? Talk to them about their teens having sex, and you can lose some friends because people do not want to acknowledge. It's hard to talk about your 11-year-old daughter being sexually active.
That brings up a whole issue there.
Yes.
But let me just say, let me throw this at you, Dr. Mercer. Phil Wilson, who's the executive director of the Black AIDS Institute, back in 2005 was quoted as saying, "The truth of the matter, in 2005, AIDS in America is virtually a black disease. The epidemic will not be over unless and until black people in America develop the capacity, infrastructure, and commitment to make it so. The time is now to create a comprehensive, coordinated mass mobilization against the AIDS epidemic in Black America." At one point in time, this started out as, or people thought of it as a white male gay disease.
Right, and that was back in 1981 when we first discovered. And over the years, the trend has really changed. In the 90s, 1993, 4, I think that's when we saw the prevalence increase in our community. And it's just skyrocketed. 60% of the HIV cases that are being diagnosed now are African American patients.
60%.
And 60%, but we're 12% of the population. And I don't know that it's a black disease. I think African Americans are disproportionately affected, as in many diseases. There is a huge disparity in healthcare.
Is it the disparity in healthcare?
Yes, there's a disparity in healthcare. We have more diabetes. Men die of a higher rate of prostate cancer. One big factor that I think patients that the public doesn't understand is the lack of trust for the healthcare providers from the African American community. We always remember the syphilis incident, and
that was with
the Tuskegee, yes. And so we just the African American patients don't always have a good amount of trust. They just believe that this is not, that HIV is not a disease that was man-made, and so I think that's a big problem.
So that's that part of it, the conspiracy theory, that this is a virus that has been injected into our community, if you will.